5 of the CyberClinic, the podcast where we explore how AI and emerging technologies transform healthcare from the inside out. I am your host, Claude Bernard, a doctoral candidate in health informatics and cybersecurity advocate. Today, we're shifting our focus to the big picture public health. How is AI transforming our ability to respond to health crises, manage vaccines, and predict the next pandemic? More importantly, how far can AI go in helping us prepare for the future? Please be aware that the names of countries, organizations, institutions, and AI tools you will hear in this presentation are strictly intended for educational purposes and do not constitute endorsements. The need for smarter public health. Let's begin by laying the foundation. COVID 19 exposed deep vulnerabilities in global public health systems, including late responses, broken supply chains, and overwhelmed hospitals. However, it also accelerated the use of AI to bridge gaps in disease surveillance, outbreak response, and health communication. AI's strength lies in speed and scale. It can analyze vast real time health, social, and environmental data. This allows us to detect anomalies before outbreaks occur, model disease spread with precision, mobilize resources before systems are overwhelmed. Without AI, our pandemic response would be slower, less precise, and more reactive. For example, BlueDot identified signs of COVID 19 9 days before the World Health Organization's WHO first alert. That time advantage may have saved countless lives. Real world examples of AI in action. Now that we've seen the potential, let's turn to the real world. How are governments, health systems, and humanitarian organizations already using AI? Here are some standout examples from around the globe. Blue Dot. Canada Blue Dot is an AI platform that detected the earliest signs of COVID 19 in Wuhan, China, 9 days before the WHO issued its public warning. It uses natural language processing to scan news reports, airline ticketing, and public health data in multiple languages. Number two, HealthMap. United States Harvard's HealthMap uses AI-driven text mining to monitor disease outbreaks. It's been used for Zika, Ebola, and influenza, and the CDC and WHO use visual dashboards. Number three, Jakarta flood mapping. In Indonesia, AI is integrated with mobile phones and social media to map flooding and predict the public health risk associated with waterborne diseases, a huge issue after climate-driven disasters. Number four, UNICEF's vaccine supply optimization. Global UNICEF partnered with IBM to create AI-powered supply chain analytics platforms. These tools improve vaccine distribution by identifying cold chain breaks, forecasting demand, and optimizing stock. Number five, India's Arogya Setu. This mobile, this mobile app used Bluetooth and GPS data to trace contacts during COVID 19. AI models flagged high risk interactions, helping local authorities target testing and isolation measures more effectively. Number six, South Korea's pandemic response system. South Korea adopted AI enhanced contact tracing, integrating credit card usage, CCTV, and phone GPS data to map exposure events. This enabled rapid quarantines and helped maintain one of the lowest mortality rates among developed countries during early COVID waves. Their AI driven alert system also reduced hospital overload by redirecting patients to lower risk areas based on real time capacity modeling. Number seven, in the United States, AI enabled pandemic tools played a crucial role during COVID 19 in several domains. The CDC collaborated with machine learning firms to enhance syndromic surveillance systems like Essence, electronic surveillance system for the early notification of community-based epidemics. That's what Essence stands for. Operational warp speed used predictive analytics to optimize vaccine distribution logistics. Hospitals and state health departments use AI driven resource allocation models to predict ICU bed shortages and PPE demand. Well, what's PPE? PPE stands for personal protective equipment. In healthcare and public health, PPE includes items worn to minimize exposure to hazards that cause serious illnesses or infections. Common examples include masks, surgical or the N95, gloves, gowns, face shields, goggles. During the COVID 19 pandemic, PPE protected frontline healthcare workers from virus exposure. The U.S. Department of Affairs also deployed an AI tool called COVID 19 Vulnerability Index to triage high risk patients across its health system. While the decentralized healthcare structure posed challenges, AI helped mitigate hospitals' strain and enabled real time public health dashboards. These are not future dreams, these are fundamental tools already in place. Can the role of AI be measured? You may wonder. That all sounds impressive, but is there measurable proof? Yes, AI's role in public health is measurable. Detection speed. BlueDot issued alerts for COVID 19 9 days before the WHO's public statement. Accuracy. A 2021 study published in Nature found that AI supported flu forecasting models were 43% more accurate than traditional ones during the early stages of an outbreak. Efficiency gains. UNICEF's use of AI reduced vaccine spoilage in remote regions by improving cold chain compliance, cutting waste by 20% in some areas. Response time. In India, AI assisted triage tools reduced time to quarantine notification by 36%, especially in urban areas. Population level impact. South Korea's AI based rapid contact tracing and triage helped maintain case fatality rates at approximately 1.1%, significantly lower than many countries with similar outbreak sizes but slower manual response systems. Potential and pitfalls. AI's public health power is enormous, but it's not without risks. Here are the positive aspects of them: early detection of outbreaks, targeted disaster response, personalized public health messaging, efficient vaccine planning and tracking. Here are the challenges: data privacy and surveillance concerns, algorithmic bias, especially in underserved populations, lack of local capacity to deploy AI tools. Ethical oversight and international cooperation are essential to prevent misuse and ensure fairness. One crucial insight is that AI is only as valuable as the data it learns from. If data sets exclude rural, minority, or underserved populations, AI risks amplifying existing health disparities. What comes next? What could be the next 10 years look like? AI will likely be embedded into national emergency preparedness strategies. Predictive models may anticipate zoonotics, spillover, events, and environmental risk zones. Wearables could become part of early warning systems for everything from dehydration to respiratory illness. Now, we mentioned anticipated zoonotics. What is that? Spillover. Anticipated zoonotic spillover refers to the predicted transmission of a pathogen from animals to humans, using tools like AI, genomics, and environmental monitoring before it happens. Let's break it down. What is zoonotic? Zoonotic is a disease that originates in animals but can infect humans. Example: COVID 19, Ebola, SARS, monkeypox. Spillover: when the disease jumps from an animal host, like bats, birds, or pigs, to a human. That's what a spillover is. Anticipated: using AI or predictive modeling to identify risks and conditions where such a spillover event is likely before an outbreak occurs. Why it matters? About 60 to 75% of new infectious diseases in humans originate from animals. Anticipating spillover could prevent pandemics before they start, guide surveillance in high risk regions, example, wet markets, deforestation zones, enable targeted vaccination or testing of wildlife and livestock. Real world example: AI models are being used to scan climate data, animal migration, and human encroachment on wild habitats to forecast high-risk zones, such as parts of Southeast Asia and Central Africa, where spillovers are more likely to occur. Governments must pair AI investment with equity frameworks, ensuring marginalized communities are not left behind, and most importantly, education. AI literacy in public health should be as critical as epidemiology and biostatistics. While hospitals across the US embraced AI tools during COVID 19, most deployments remain fragmented. There's no universal standard for using AI in forecasting, triage, or prevention. Health systems use various models, tools, and data sources, which are often incompatible. As we advance, agencies like the CDC and NIH are working to modernize public health infrastructure so that AI systems can talk to each other, learn from each other, and act faster together. The Public Health Informatics Infrastructure Modernization Act and NIST's AI Risk Management Framework are early steps in building a shared future. To conclude, so how far can AI transform public health? Quite far, one can argue, if we build and use that system responsibly. We need AI to predict and prevent the next crisis. With transparency, equity, and scientific rigor, the next pandemic might not surprise us. Join me next time on CyberClinic as we explore AI's growing role in global mental health, from therapy bots to real time crisis intervention. Until then, stay safe, stay aware, and stay ahead. I'm Claude Bernard, and this has been CyberClinic. Please remember to subscribe, share, and comment. Thank you.